We need to make sure that we focus on those vulnerable children, on those children that are urgent cases, and those other vulnerable in our community that we still have to cater for. So it's about focusing resources and allocation of resources in the right place.
Now, you mentioned there something which is very relevant. The pandemic, of course, halted all medical services, but there was also mention of understaffing within the dentistry here at the GHA. The Unite took this up in 2021 and then in 2022, and then again in 2023. They still had some concerns regarding understaffing. How's that being addressed?
Sure. So there are conversations with the union. I can't really comment on those at the moment. But again, it's about understanding what we are dealing with so that we can, again, allocate resources appropriately. And there's been a massive investment with regards to addressing this. So we are going to be getting an extra dentist and an extra orthodontist, again, trying to focus on the clinical priority of these children so that the ones that are most severe would be seen and treated as soon as we can, and again trying to see those children that either have not been seen before or are in need of further urgent treatment.
Do we know how many children are affected? The last statistic that we have available dates to 2022, and 1,700 children were awaiting their first checkup. How correct is that?
So again, it's about analysing the data that we have available to us. The data now is going through an IT process, so that data is not accurate in that we have been seeing children throughout. So we need to come up with more accurate data with regards to those children that haven't been seen as yet.
The aim is to tackle the backlog within 5 months. Is that realistic?
It will be realistic with regards to the data we have available and the number of children on that particular waiting list. So by having a full-time dentist only seeing those children that we have to prioritise, it should take 5 months for every one of them to be seen and assessed, and then decide on what further treatment they need.
And moving forward, you've engaged the services of one extra dentist or clinician. Is that a permanent solution? Is that a permanent increment in staffing? And how do you intend to keep up in order not to have any more backlogs?
Yeah, absolutely. And it's about allocating resources to become as effective and efficient as we can. So by changing the way we work and allocating the workload appropriately, then we can continue forward being as effective and efficient as we can.
How does it work today? Do parents need to be proactive, or will the school service be assuming this?
Yes. So we have found that it has been an opt-in service. So we worry that those that perhaps most vulnerable are not opting in are being missed. Therefore, our IT department have created a system where automatically at the age of 4 we will be calling patients in so that we're able to do the first assessment. We're also going to be targeting the children at the health visitor and the 8-month and 2.5-month check with the GP. So we will have a dentist allocated there again for a lot of primary prevention, a lot of education to try and reduce the amount of problems in the future.